Hi, my name's Trevor Holt. I've been an elected member of Bury Council for 33 years. I was born in Bury and brought up in Bury, and I'm immensely proud of the borough that I live in. It's a fabulous place to live, work and grow up. I am aware though that we have some health inequalities in Bury which are causing us major concerns and major worries. These are being addressed, but I think we need to be vigilant, we can't be complacent, we have a lot of work to do together with our partners to achieve reducing those health inequalities. I would hope we can continue doing that, and I'm particularly interested in the smoking cessation programme, which is causing so much concern and many early cancer-related deaths in Bury. So we have a lot of work to do together as partners, and I look forward to being part of the team.
Hello, my name is Jones-Greenalgh. I'm the Executive Director for Communities and Wellbeing and Deputy Chief Exec of Bury Council. My role on the Health and Wellbeing Board is I have a broad range of services within Communities and Wellbeing, ranging from adult protection or waste management or potholes. It's so wide ranging, and my job is to bring that forward to the Health and Wellbeing Board and connect the strategies to improve the population health of Bury and the wellbeing of Bury. So because looking at also manage civics and the leisure and all those things around prevention and intervention of the people we serve in Bury. I have a significant role in developing and designing the One Commissioning organisation, the local care organisation, and fundamentally developing an asset-based approach to neighbourhoods where it empowers the individual, families and communities to take responsibility for their lives and only come for support when it's absolutely needed. So we're in an enabling and preventative type time now, which is fundamental to improve people's quality of life.
Hi, I'm Councillor Shari, and I'm the leader of Bury Council. Health and wellbeing and improving the health and wellbeing of our residents is a really important priority. Firstly, to ensure that they live happier and healthier lives, and we want to work to ensure that people eat better, are more active and engage in more physical activity. We also want to ensure as a Health and Wellbeing Board that in those circumstances where people do need support, they get the right care at the right place at the right time. The Health and Wellbeing Board will drive that work, working with a range of partners in the health service, in the police, in the fire and the private sector. I really value the work that the Health and Wellbeing Board does, and I'm proud to sit on it, and hopefully we can have a happier and healthier future for all Bury residents and their families.
Hi, I'm John Aspinall. I'm the Commander for Oldham, Bury and Rochdale areas within Greater Manchester Fire and Rescue Service. My involvement on the Health and Wellbeing Board is principally aligned to not only Greater Manchester's corporate objectives in line with public service reform and the devolution of Manchester agenda, but also to support the aspirations of the Health and Wellbeing Board in context of a healthier and much improved lifestyle for the communities of Bury. The aspirations of myself in terms of my remit and the offer that Greater Manchester Fire and Rescue Service hopes to make to the Health and Wellbeing Board is to hope it achieves its objectives and support where necessary by involving not only our resources but our other linkages into other partner agencies and the use of our data to support where necessary achieving the objectives.
Hello, I'm Chief Inspector Joe Marshall from Greater Manchester Police. I sit on the Wellbeing Board at Bury on behalf of Bury Police. We have an interest in all the board's priorities as police officers, but specifically we're interested in priority 1, which is all about giving people a positive start in life. We see this as a hugely important priority, prevent individuals feeling that crime is a viable life choice, a viable option. Going forward, our vision as police officers on the board would be to be an integral partner. We would like to be involved in service provision for all the early intervention strategies around the borough where needs are identified very early on to prevent people becoming involved in or again feeling like crime could be a viable life choice for them.
Good morning, I'm Stuart. I'm Chief Officer of Bury Clinical Commissioning Group. I'm here today to just describe what I do and my role on the Health and Wellbeing Board. As Chief Officer of the Clinical Commissioning Group, in the sense that my other title is accountable officer, so I'm accountable for the decisions of the organisation and support the clinical leaders in making the decisions about care pathways and improving healthcare that's commissioned for the residents of Bury. The role on the Health and Wellbeing Board is very important, as I am committed and we are committed to operating in a more joined up way with the local authority and to have an integrated health and social care commissioning function, removing the barriers and silo working, and having a situation where the patients and the users of the services see joined up services and do not experience situations where they have to explain themselves more than once.
Hello, my name is Mark Carriline. I'm the Council's Executive Director for Children, Young People and Culture, and I've been a member of the Health and Wellbeing Board ever since it began, in fact even when it was a shadow. In terms of my job and my role, the department I'm responsible for provides all the different services for children, young people and families in the borough. So in particular, we have a strong emphasis around schools and education and around children's social care and safeguarding, as well as a few other things such as youth work and also on the cultural side, libraries and museums. In terms of my particular interests, obviously I've got a particular interest around the children and young people's agenda, and I lead on the starting well priority within the strategy. Particular areas of interest for me in terms of the health agenda are especially around emotional health and well-being. It's a huge issue, and if you talk to people who work with young people in schools, colleges, wherever, they'll say there is a growing level of need out there. So from the point of view of myself and all the partners who work on children's issues through the Children's Trust, this is one of our absolute top priorities. Alongside that, we've got some particular concerns around substance misuse, both as it applies to children themselves and young people, but also as it applies to their parents and the impact it can have on their ability to parent well. So there's some of my key priorities.
Hi, I'm Dr. Kiran Patel. I'm a GP at Greenmount Medical Centre. I've been there for the last 20 years. And for the last 3 years I've been chair of our local clinical commissioning group. We're responsible for commissioning services that really touch on all of the priorities of the Health and Wellbeing Board. As a GP, I'm really passionate about working and improving the quality of care and the lives of people with chronic illnesses and as they get older and into old age. So really the priorities that we're concentrating on are the ones about living well with illnesses and aging healthily so that you have as long and productive a life as possible.
Good morning. My name is Shari Briggs. I'm a councillor for Radcliffe North. I've been a councillor for Bury for 12 years now and currently a cabinet member for children and families. As a new member of the Health and Wellbeing Board, I'm really excited to use my skills and professional background as a social worker to contribute to the workings of the board. Health and wellbeing is important for all people, to enable them to have a fulfilling life and to make the most of the opportunities available to them. My focus on the board will be young people and looked after children.
Hi, my name's Dave Bevitt. I'm the Chief Officer of Bury District Citizens Advice Bureau Service and was Chair of Bury Third Sector Development Agency. I was elected to the Health and Wellbeing Board by the Third Sector Assembly. I've worked in Bury in the Citizens Advice Service for over 15 years, so I know the town well. I'm particularly interested in Priority 2, Living Well. I'm particularly concerned about the effects of poverty and inequality on people's standard of living and on their life chances. I really believe in the importance of access to top quality information and advice to help people live well. And I'm also very interested in raising the profile of the third sector, which has a lot to offer, particularly in very difficult economic circumstances.
Hi, my name is Lesley Jones and I'm the Director of Public Health for Bury. I'm a statutory member of the Health and Wellbeing Board and I'm also a member of NHS Bury Clinical Commissioning Group governing body. As a Director of Public Health, it's my role to help the Health and Wellbeing Board and partners understand the health needs of the population of Bury and to help develop evidence-based strategies for improving health and wellbeing and reducing health inequalities. I know that we can take action right from when babies are first born or even before they're born, whilst during pregnancy, right through from cradle through to grave. We can be taking action right across the life course to improve everybody's health and well-being and help people enjoy a healthy, happy, long life.
Hello, my name's Heather Crozier. I'm Head of Social Development for the Communities and Wellbeing section at Bury Council. I'm also the Policy Lead for the Health and Wellbeing Board. I work alongside Democratic Services to ensure the smooth and effective delivery of all the work programmes for the Health and Wellbeing Board. Most recently I've been involved in refreshing the Health and Wellbeing strategy. I do feel really passionately about supporting people to help themselves to good health and wellbeing, and my role currently is within the local authority is to ensure that communities are engaged in their own health and wellbeing, and we reduce inequalities amongst our communities.
My name is Gallagher. I work within Democratic Services at Bury Town Hall, and my role in terms of the Health and Wellbeing Board is providing constitutional support and advice to its members. Thank you.
Hello, my name's Chloe McCann. I am an Assistant Improvement Advisor in the Corporate Policy team at Bury Council. My role on the board is to support the Policy Lead and Democratic Services to ensure smooth running of the board. Recently I have been working on developing the work plans that sit under the Health and Wellbeing strategy, as well as the marketing and promotion of the Health and Wellbeing Board.